Imagine this. You are in Germany sitting in a doctor's office. You have been waiting for months, weeks for this appointment. And finally, the appointment is there. Then the doctor walks in, quick greeting, no small talk, just a few direct questions. And then before you could even answer the next question, the appointment is over. 7 minutes, that's it. Now, if you are an African patient, this can feel strange, cold, confusing, frustrating. For some people, they say it's racism. For others, they say it's disrespectful. Because back in Africa, it is a different system altogether. When you go to see a doctor in Africa, the doctor does not just, check your blood pressure and chow. The doctor sits with you, have a conversation with you. It's a kind of holistic approach, which is quite different from, what we have here in Germany. The doctor is patient enough to explain to you what is going on. Sometimes some doctors pray for you. Others reassure you even when the situation is quite complex. And they build this connection, in a way that patient feels reassured. Like for some people, it is the beginning of their healing. Yeah, the doctor told me everything will be fine. And for them, they believe it. Everything will be fine. But coming to Germany, where everything is so rushed, the question still remains, do doctors in Germany really understand African patients? This is a very big question, a very complex one at that. Because the thing is that many people, because of this situation, have doubts in the system. Many people don't trust the system anymore. But imagine trusting the system, not trusting the system, when you are at the receiving end of the whole thing. Now, the objective of every healthcare system is health equality. And health equality entails that everybody must be treated equally, no matter where you're coming from. Germany has one of the best healthcare systems in the world, and they are bringing it to us on a platter of gold. So, having doubts in the system is like doing ourselves a disservice, because we are not taking advantage of what this beautiful health system is offering. So the question is, how do we bridge this gap? Because it is very important to bridge the gap for our health, for our dignity, and for our trust in the system, to be able to take advantage of what the system is offering. So, like I said, this is very, very important. And that is why we are going to talk about it on this podcast. We are going to talk about what Africans expect from the German healthcare system, what the German healthcare system can offer. How can we bridge this gap? So today, I am not here complaining about what the German healthcare system is doing to Africans in the diaspora. I am here to give you tools on how you can navigate this system without so much stress. Because the truth is, no matter the system, no matter what the system, does, we can still thrive. Welcome back to the Diaspora Seat, where we talk about everything health, dignity, identity, and struggles of Africans in the diaspora. My name is Micheline. Let's get into the sweet spot. In many African communities, healthcare is not just about illness. It's about trust. It's about conversation, Often it's even about family being part of the process. And this is really opposite of what we have in Germany. The German healthcare, like I said before, is one of the most advanced in the world. It's efficient, precise, rule-based. But it is also a very different system, from what we have, back home in Africa. Short appointments, direct communication, little time, to talk about things. Sometimes you don't even get, to talk to the doctor in details. Most people take their blood test results, without explanation. Some people, they just send it to you to your house because they feel that everything is fine. So they just send it to you to your house, figure it out. But the question is, how can I understand, what is in my blood test? If my blood test is okay, does it mean that there is nothing I have to do to improve myself? And that is why for some people, this is a little bit frustrating. For a German patient, that is perfectly normal. But for us Africans, it can feel a little bit cold. And like I said before, frustrating. So today, I am going to be talking about 3 things. 1, what African patients usually expect from the German healthcare system. What the German system actually, provides, and how we can bridge the gap with confidence and preparation. So let's start with the expectation. What Africans expect, when they go to a doctor's office. Now, in Africa, we expect doctors to take time, to explain things to us, to give us reassurance. Some people even involve, spirituality in care. Now, I want to tell you something. In Africa, these doctors understand the system. They understand the culture. Some people might even be telling their doctors things like this. My neighbor was burning candles and incense. I think that was really what was affecting my health. Then they could even say something like this. I had a dream where this kind of, some kind of thing is happening to them. And I think that dream is the manifestation of what is happening to me. For a doctor in Africa, he understands these things, but for somebody in Germany, he does not understand superstition. He does not understand why your neighbor burning candles or incense should affect your health. This doctor does not understand why your dream, should be a manifestation of what is happening to you. Doctors in Germany works with facts. They'll ask you your symptoms, they look at your lab results, and then they treat you, and that's it. There is no time to talk about, these kind of things. There is no time to pray. If you want to pray, pray in your house in private. It's none of their business, So this is really where the contrast is real. I once had a woman, say the doctor never even looked at me, just at the computer. That broke her trust more than the illness itself. That's so sad. But the thing is that it's not that the German doctors don't care. It's that the style of care is completely different. And that's what we should understand. Like I said before, these people don't know what superstition is. These people don't know why your dream should be a manifestation of your health. So our expectation, should be more like, I want to get treated. And that's it. Talking about what the German system provides. This is really where, we just have to give credit to whom credit is due. Germany has one of the best healthcare systems in the world. I've said that before. Technology, top notch. Check. Universal insurance, top notch. Check. Highly trained professional, top notch. Check. That system works because it's efficient. And seriously, it is really so good. I work in the system, so I really know what that entails. Doctors are trained to be precise, focused, and they are not trained to joke at all. And besides, there are too much people. Most of them are really working under stress. Short appointments aren't considered rude. They are just the standard. They are just what they want is, okay, what is happening to you? Answered. What can I do for you? Answered. Lab result, done. Then they check the lab result, everything is good. Prescription, ciao. That's it. No waste of time. But I think in some way that is a little bit okay, But here's the key point. What feels professional to a German person, can feel dismissive to an African person. That's not about bad intention, but something like a kind of cultural mismatch. Because remember, you are coming from an African, continent where culture and, visiting the doctor's office is, is experienced in a different way. And coming here, it's a different, it's also a different, thing. Because even for the people, for the natives, it's also the same thing. You go, you just do your thing, and seriously, you are out. But here's the good news. Once you understand this system, you can navigate it better without so much stress. So consider this. This is not about bad intention. If I go to the doctor, what's my objective? My objective is to get better, to be able to function well in the society. Then focus on that. Talking about cultural mismatch, because this is where I am, focusing on, because some people frame this, as racism. And yes, of course, I think that, sometimes prejudice exists. But personally, I don't give that my energy. I chose to see it differently, If someone treats me unfairly, it says more about their ignorance than it says about me. For me, that is self-ridicule, and not my identity. The bigger issue here, most of the time is misunderstanding. For example, a patient says, "Doctor, my whole body is weak." The doctor says, "Where exactly? Since when?" Rate the pain from 1 to 10. Two different communication styles clashing. One is broad and emotional. The other is precise and clinical. This is what it is. If I wasn't a nurse and I find myself telling somebody my whole body is paining me and you're asking me where exactly, I'm going to be like, excuse you. I am telling you I have pain and you're asking me where exactly as you rate from 1 to 10, But because I am in the system, I kind of understand how these things work. And that is why I'm talking about this, because giving you people this tip, is very important for you to understand how to navigate the system. So you can see 2 different communication styles. One is broad and emotional, and the other is precise and clinical. So if we recognize that, we don't take it personal. So we adjust and prepare. We can whine all day that this system is not doing us right. We can say that, we want the system to change, but seriously, this system is not going to change because the system has been there before we came and the system is going to be there even when we are gone. So the most important thing we should be focusing on is on solutions. How do we bridge the gap? How do we make this system work for us? Because we are the one at the receiving end, whether we like it or not. The system has a laid out advantages, that we can take advantage of. But if we sit with the mindset that we don't trust the system, when we are the receiving end, we are the one losing. There are so many things that this system can offer. For example, the preventive healthcare screening. If you take advantage of this preventive healthcare screening that this system has, you would realize that, your health is almost guaranteed. Your lifespan, in Germany is almost guaranteed. Now, let's take, for example, when you don't take advantage of this preventive healthcare screening, we already know that preventive healthcare screening can help you, help you detect illness before they get worse. And it can also help you, have a rest of mind if nothing is dictated, because you already know that, nothing is wrong with me, so everything is cool. Now, let's take, for example, when you didn't take advantage of it, something hits you and it hits you hard. Then you get to the hospital. Instead of the doctor to be telling you you are at stage 1 or something is developing, that is when you take advantage of the preventive healthcare screening, then the doctor will be telling you you are at stage 4, and stage 4, whether cancer or kidney issue, these are kind of like, terrible stages of life. And seriously, your quality of life will not be the same again, and you will be full of regrets. So instead of being full of regrets, let's work on how we can make the system work for you. And that is why I developed these 3 strategies. Well, maybe not me, but I researched, for it, and I was able to come up with 3 strategies that can really work for us. And I think, and I believe that every African, in the diaspora should know this, because seriously, it's very important and something very easy things that, easy strategies can help you. Let's talk about the first one, knowing your right. You have the right to clear explanation. You don't have to leave without understanding your diagnosis when you are at the doctor's office. The doctor already knows that you have the right to, clear explanation of your diagnosis. If you don't understand it, call the doctor back and tell the doctor, please, can you explain in simple terms? I don't understand medical jargons. The doctor will have that patient to explain it to you. When we talk about 7 minutes appointment, it doesn't really mean that after 7 minutes, they will chase you away. No. If you call the doctor back and tell the doctor, please, I want the explanation of my diagnosis in a clearer way, they will take their time and they will give you that explanation. During that, explanation, if you have opportunity to write down things so that you don't forget anything, it is very important. One thing I want to add to this is that you also have the right to a second opinion. Let's take, for example, you are not comfortable with what that doctor is saying. You can decide, okay, I want to go check another doctor to see what that other doctor would tell me. Then you are also able to have the opinion of, both. Then you'll be able to come back home, sit down and take decisions. And this brings me to the next, strategy, which is preparing for your appointment. Now, before appointment, many people don't really prepare. They just go there and they just start. When the doctor, is asking them questions, they find it difficult to say because they are not prepared. Preparing your appointment means writing down symptoms, questions, and concerns, about your overall health. It will help the doctor, these specific details will help the doctor give better answers. Now, when you are not prepared and you go there, the doctor is asking you a question, you will be very snappy in answering the question. And that is why your appointment will only end in 7 minutes and ciao. At the end of the day, you feel disappointed. So preparing in advance of time. Now, there are so many ways you prepare, and I'm going to give you an example of what I do personally, even though I am a nurse, but this is what I do personally. I do research. For example, if I have symptoms like, headache, frequent urination at night and all that, I need to write it down. There are so many tools out there. AI tools are just everywhere and they are free. You have them in your handy. All you need is just to download an AI tool like ChatGPT, and ChatGPT can, tell you lots of things. I'm not saying it is 100% right, but it gives you like an idea. For example, you are preparing for your appointment. You have all your symptoms listed. Then go to ChatGPT and type, these are the symptoms I'm having. ChatGPT will give you an idea of what is going on with you and tell you these are the ways you can, the questions you need to ask your doctor, the procedures, what do I do? What prescription do I have, and all that. When you are also giving a medication, you should be able to ask, what are the negative side effects? How is the success rate? Are there alternatives to this medication? These are kind of things you need to ask. You don't have to be afraid because the doctor know it. Now, the next one is bring support if needed. For example, in a situation you don't understand Deutsch language, you don't understand German language, it is very important that you bring someone along with you who understands the language that will be able to explain the whole thing to you. Some doctors understand English and can speak English very well, but some, they don't have any idea, So important thing is that you bring somebody along with you. When you don't have anybody, tell them, I need a translator. The hospital can provide a translator for you. But sometimes I don't really give people the tip of, using the hospital's translators. It is better you bring someone you trust, a friend, someone very close to you, because the person will be able to give you the right translation of what you need, because the person has your interest at heart. And I don't mean that these other people, they don't have your interest at heart, So these are very important strategies that you should take advantage of, and these are not signs of weakness. They are signs of wisdom, When you walk in prepared, you take control of your health. And this is the mindset, that we should be focusing on instead of waiting for the system to change for us. We learn how to navigate the system with confidence. So finally, do doctors in Germany really understand African patients? The truth is, not always. But here's the bigger truth. We don't have to wait for perfect understanding. We don't have to wait for somebody to look at us or pay attention to us to say that, yes, this person cares, because that's not the objective. With knowledge, preparation, and the right mindset, guys, we can get the care we need and deserve. And remember, the strategies I mentioned in this episode, they are the key to you navigating the healthcare system in the diaspora with so much confidence. 1, you have the right to a clearer and thorough, detailed explanation of your diagnosis. 2, you have the right to a second opinion. So you can decide, to go for a second opinion if you feel that the other doctor is not really, explaining the things that you really want to know. Another thing is that you have a right to bring a translator along with you, a closer friend, somebody who has your interest at heart. Another thing is that you have to always get prepared. Make research, listen to health news, listen to health podcasts. These things will help you navigate the system, in a better way with so much confidence. Now, remember, if someone treats you unfairly, it's not a reflection of your worth. That's their limitation, not yours. So guys, I would like to hear from you. What has been your experience with healthcare in Europe? In Germany, in Sweden, Denmark, Norway, Finland? Let me know in the comment section below. Did you feel understood, or did you have to push for clarity? Let's get the comment section going. This has been the Diaspora Seat. Thank you for listening. And remember, your health, your story, and your confidence matter.